Good morning, everyone. My name is John Masker. Thank you so much for tuning into my presentation today. I am currently studying exercise science with a minor in health sciences at the University of Nebraska-Kearney. For this presentation, we were asked to address an uncertainty or kind of misconception within our desired career choice. As many of you know or probably do not know, I am an aspiring physical therapist. I am also currently a physical therapist technician at New West Sports and Orthopedic Rehab. You know, during my shifts at New West, I've given many therapeutic ultrasounds to many patients. Now, during giving those ultrasounds, a reoccurring question always kind of comes to my mind, and that is, what exactly is this treatment modality doing for patients? So obviously, from briefly conversing with the therapists that I work with, I have gained, some general knowledge about therapeutic ultrasounds. However, I wanted to take it a step further and gain more knowledge on the matter. So specifically, this presentation will give you guys some background information, just kind of get you oriented with what therapeutic ultrasounds are and what type of conditions they are used on. Also, I will be discussing the proven effectiveness of therapeutic ultrasounds, as well as, I will address a common misconception that many people kind of believe that therapeutic ultrasounds do. And as we go along, I will kind of synthesize the information and give my thoughts, and I will conclude it up. So without further ado, let's get started. So, as I mentioned prior, I've had some general knowledge on what therapeutic ultrasounds, but I'm sure many of you guys do not really know what they are and what they do. While researching the topic of therapeutic ultrasounds, I found a good description from a website called verywellhealth.com that describes what this treatment modality does in the simplest way, but it's very clear, and I think it describes it well. So to summarize it for you guys, a therapeutic ultrasound is a common treatment modality used in physical therapy, like I mentioned. It is used from a machine that has a transducer, is what they call it, or commonly it's known as the sound head. And inside the sound head is a tiny little crystal, and when an electrical charge is applied to it, it vibrates rapidly within the sound head. When the crystal vibrates, it creates some waves that are called piezoelectric waves, or piezoelectric waves, I think is how you pronounce it. And these piezoelectric waves are then emitted from the sound head or transducer as ultrasound waves. Yeah, and as many of you know, ultrasound waves are emitted at a super high frequency, so our ears cannot pick it up as sound. So here are two visuals of therapeutic ultrasound machines. So just kind of give you guys a little, what you can see when I'm talking about. So this right here is the ultrasound transducer or sound head, and this is what is physically applied to the body. This is a Richmar therapeutic ultrasound machine, and this is a Solaris ultrasound machine. These are two very common brands that make these devices and sell them to healthcare professionals. So typically when you use these two machines, or what I've witnessed is the procedure follows as the physical therapist or other healthcare professional will apply a small amount of gel to the desired area of the body that they want to treat. Then they will, you can set the settings here. This is the time, how long the ultrasound will last. This is the intensity, so how intense will these sound waves be emitted. And then down here, I know it's kind of hard to see, but this is when you can choose your frequency and continuation. So that's just basically, how often will these sound waves be emitted during the treatment. And so once all that is set up, the therapist will then, take the sound head and place it in direct physical contact with the area they want to treat and move it in a small circular motion. And even, most of the time, physical therapists will use, or will not use, I should say, but combine the gel with an anti-inflammatory medication to help treat pain and inflammation while they're performing the ultrasound. So it's kind of a 2-in-1. So now that I have, kind of described what a therapeutic ultrasound is and how it works, now you guys are probably wondering, so what type of injuries can therapeutic ultrasounds include as a modality? And so typically what I have seen and what I've researched is that therapeutic ultrasounds can be used, obviously on a wide variety of patient conditions, but most commonly they are used on conditions that are post-operation, soft or hard tissue repair, which would be like, if someone tears their muscle or has a lumbar fusion or any type of fusion with their bones or a bone break. That is when I've seen therapeutic ultrasounds be used. But they are not only used for just those conditions. They are also used on, less strenuous situations like tendinitis, which is inflammation of your tendons, and that can be in any area of the body. Bursitis, which is, inflammation of the bursa. We have bursa that kind of help cushion our joints. They also are helpful in joint tightness, which, you see a lot of cases where individuals have an operation and lose their range of motion over a period of time just because they don't lose it. And also, therapeutic ultrasounds are good for use in strains and, kind of sprains of, whatever muscle or soft tissue group in the body. So now that I've given you guys the who and what's of therapeutic ultrasounds, now it is time to shift thoughts a little bit and kind of elaborate on the proven effects of therapeutic ultrasounds. And first, the first one that I've found, through various medical journals, but most credibly the one that I found, the journal that I found most credible was the Journal of Orthopedic and Sports Physical Therapy. And they concluded, as well as the many others concluded, that therapeutic ultrasounds are effective in relieving pain in various anatomical sites. So in the first study I found here, you can see within the journal, it's titled Current Pain and Headache Reports. The authors concluded that therapeutic ultrasounds are a safe and effective method in treating pain in patients with myofascial pain syndrome. If you guys do not know what myofascial pain syndrome is, it's a condition characterized by dull but deep, poorly localized, which means they can't really specifically target where the pain is coming from, but it's coming from those myofascial tissues within the body. And those who aren't familiar with what myofascial tissues are, I know probably many of you are. But just to explain, the myofascial tissues are thin, fibrous, but strong connective tissues that, they surround our muscles and our bones within our body. So that this study here concluded that ultrasounds are a safe and effective method of treating that condition. So in the second study you see here that I found in Acta Informica Medica journal, this study assessed how effective therapeutic ultrasounds would be in treating individuals with degenerative musculoskeletal disorders. So what they did was they took two groups, and prior to the study, they assessed their pain level on a visual analog scale, which is basically they asked them on a scale of 1 to 10, what is your pain level, from 0 being no pain to 10 being the worst pain you can imagine. I think many of us are familiar with this. And so after the study, they concluded that in group 1, the participants had an average drop in their pain level by 4 points on the scale, while group 2 had an average drop in pain levels of around 5 points. So as you guys can see, this is a very significant decrease in pain levels for these patients. And finally, in this study in the Journal of Clinical Rheumatology, these researchers wanted to see the effect of therapeutic ultrasounds in treating osteoarthritis, and specifically that osteoarthritis was in the hip joint area. And from conducting the study and concluding, they found that therapeutic ultrasounds were effective as an additive treatment, which means they didn't only use therapeutic ultrasounds to help treat these patients, but they used it as kind of an extra. But nonetheless, they found that when combining therapeutic ultrasounds with their other treatment modalities, they found that these patients had a significant increase in functional status, overall quality of life, and of course, decreased pain. So drawing from my own personal experiences working at New West, we use surveys to assess patient progress, and I've seen that many times people that use or patients that have therapeutic ultrasounds performed on them have a very significant decrease in pain from the time they start, from the time we discharge them. I can even go as far to say that I've heard, per conversation of the patient with the physical therapist or physical therapist assistant, that many people do get that immediate pain relief, from the following day or a couple days after. We typically schedule patients, every other day for their treatment program. And I've even heard them say that, they experience pain relief immediately in those days following the treatment from ultrasounds. So yes, I do believe that ultrasounds are an effective method of treating pain in a various setting of conditions for the patients that need physical therapy. So shifting thoughts a little bit, but still staying on that overarching theme of the proven effectiveness of therapeutic ultrasounds. Therapeutic ultrasounds have also been proven in many studies that I found that they also can provide deep heating for the internal tissues of the body. So in another study conducted by the Journal of Orthopedic and Sports Physical Therapy, they found that treatment with a 3 megahertz continuous ultrasound provided an average temperature increase of 3 degrees Celsius, within human muscle tissue. I know that doesn't seem like much, but you got to realize they're measuring this increase in degrees Celsius, which is more than degrees Fahrenheit. And also, an important note along with this is that when you deeply heat internal tissues of the body, this can lead to many desired outcomes. These outcomes that I've mentioned include, muscle extensibility, which is how well our muscles are able to stretch. And with that muscle extensibility comes increased joint range of motion, which is a very, very much desired goal within the practice of physical therapy for many patients. In another study that I found, therapeutic ultrasounds provided, deep heating to these trigger points, specifically in the upper trap muscle. When individuals have stiffness in their muscles, they would typically tend to a deep tissue massage or even injections, and those two types of treatment can be very painful. Therapeutic ultrasounds provided a less invasive way to treat this pain, and nonetheless a very less painful way to treat it. And finally, the same researcher conducted a study on individuals who had a traumatic injury to their wrist and needed an operation to fix their condition or injury. And he found that therapeutic ultrasounds provided a significant increase in joint active range of motion following the treatment process. After he was completed with the treatment and study, he had the participants come back. I believe it was 6 weeks after completing the treatment, and he found that these individuals were able to maintain their range of motion even after 6 weeks. I think the figure was 93% of the patients that he tested were able to maintain this active range of motion in their joint, specifically the wrist. So, drawing from my personal experience again, yes, I do think that therapeutic ultrasounds are a good method in deep heating internal tissues, specifically muscles. When I have talked with a therapist, they stated to me that this is one of the main reasons why they use therapeutic ultrasounds, is for this deep heating method. Many of them even note that they see, accelerated gains in active and as well as passive range of motion when using therapeutic ultrasounds versus when they do not use therapeutic ultrasounds. So I thought this was a good and encouraging piece of evidence directly from the PTs that I work with, that kind of, just reinsure that therapeutic ultrasounds do provide that deep heating that many of the patients that need physical therapy truly need. So now that I've highlighted on, the few positive health outcomes that therapeutic ultrasounds provide for patients, I would just now like to address a common misconception or myth, if you will, associated with them that has been floating, around the healthcare field for many years. That myth is that therapeutic ultrasounds actually speed up the healing process in soft tissues by a process called cavitation. Now, it had been thought for many years that this was, yes, this truly was the case, that therapeutic ultrasounds did this. But now, more current research tends to say that therapeutic ultrasound treatment for accelerating, the healing by cavitation is really no better than a placebo treatment. So now, before I dive into this myth a little more, you guys are probably wondering, I got some big words in this presentation. So what is cavitation exactly? And so this study in another arthritis journal called Rheumatology, they provided a good definition on what cavitation is. And so I would just like to read this definition to you guys, and that is: cavitation occurs when gas-filled bubbles expand and compress because of ultrasonically induced pressure changes in tissue fluids with a resulting flow in the surrounding fluid. So now there are two types of cavitation. One is stable and the other is unstable. And stable or regular cavitation is considered to be beneficial to an injured tissue, while unstable or transient cavitation is considered to be detrimental to a tissue. So now to dive in and address this myth. Once again, the myth is that therapeutic ultrasounds speed up healing in soft tissues by a process called cavitation. And now this was kind of an interesting, search for, the really backed up information. And so it was interesting because I found a lot of information, prior, I know this is a long time ago, but prior to, 1980, a lot of those studies indicated that, yes, therapeutic ultrasounds do speed up the healing process in many of these soft tissues. But, now, post 2000, these studies, everyone that I looked at concluded that therapeutic ultrasounds, do not speed up the healing process. In no shape or form, there were no significant, decreases in time or anything that backed up that they truly do accelerate healing. So to elaborate on this matter a little more, it was also interesting, like I've stated before, many of these studies would be in vitro and in vivo. So in vitro means they would be conducted in a lab, in a laboratory setting, and in vivo would be in a clinical, or would be using live human subjects for the study. And what they found was that therapeutic ultrasound did in fact speed up the healing process in vitro settings, but did not in vivo settings. So I just want to share a quote with you guys that I found from a really good article that had a bunch of different trials within it. It kind of summarized a bunch of these different clinical trials that physical therapists conducted. And that was, the quote reads, "There's little evidence of the clinical effectiveness of therapeutic ultrasounds used by physical therapists to treat patients with musculoskeletal injuries and promote soft tissue healing. There's also little evidence that active ultrasound treatment is more effective than placebo treatment for treating patients with musculoskeletal injuries and to promote soft tissue healing." So now you guys might be kind of confused. I just want to clear the air. I know I stated that ultrasounds are effective in treating patients with degenerative musculoskeletal disorders. This is a very different thing than musculoskeletal injuries. So yes, therapeutic ultrasounds do help with degenerative disorders, but do not promote healing in injuries to musculoskeletal sites. So just to highlight one more study that I really thought kind of proves that therapeutic ultrasounds do not promote soft tissue healing was in this study, and once again, the Journal of Orthopedic and Sports Physical Therapy. And they were looking at an effective treatment method for plantar fasciitis. And plantar fasciitis is one of the most common causes of heel pain in people in the United States. It is, characterized by inflammation of the plantar fascia at the bottom of the foot, just by overstretching and straining. And it can be a very difficult, condition to treat sometimes. And they concluded that therapeutic ultrasounds should be completely excluded from the treatment of plantar fasciitis because they had zero effect on any form of helping, that plantar fascia at the bottom of your foot heal. If plantar fasciitis can include, a little bit of tearing or straining of that plantar fascia. So I thought that was interesting as well. So it can be concluded that through these various studies that therapeutic ultrasounds do not promote soft tissue healing in any area of the body. So to kind of synthesize all this and conclude it, just to go back to that myth I discussed just a little bit ago, when talking with the PTs, when they were some of the older PTs that work at the clinic I work at, when therapeutic ultrasounds were kind of a new and trending treatment, it was truly once thought that they did help promote the healing process. And so that's why this treatment modality got so huge and so popular within physical medicine. But also now they've kind of realized through their upkeep and research that yes, this is not the case. They do not heal tissues in any way. And the younger physical therapists that I've talked to have the same viewpoint. Once again, they do not speed up healing. So to kind of just tie it all together again, there are many pros and cons to therapeutic ultrasounds. They are proven to do a lot of good things for people, but the problem is with this treatment modality, there's just a lot of variability with different types of conditions in patients that come into physical therapy clinics. Especially in an orthopedic clinic, you're going to see conditions that vary from, nervous disorders to musculoskeletal disorders, to simple, degenerative diseases like I mentioned earlier. So just for example, it's going to be a therapeutic ultrasound may be very effective in treating, like patellar tendonitis in someone, but it also might be very ineffective in treating someone who had a full rotator cuff repair. So I think that's one of the downfalls of, of the many of the studies I have found, but I do think that they provide sufficient evidence into, proving what they do and what they can't do. And just in my personal opinion, I do think that therapeutic ultrasound should be continued as a treatment method within physical therapy. I do think the pros outweigh the cons. And I do think many of the conditions do get the benefits, and many people do benefit from this treatment. And, the overarching goal of PT is just to get people back doing what they want to do in everyday life, doing what they love. And with that comes relieving pain. And I think that's the biggest area that therapeutic ultrasounds help with, and PT helps with, is just relieve pain. And so for that reason, I think they should continue to be used throughout physical medicine. So that is all I have for you guys today. Thank you so much again for tuning in, and we'll see you next time.